A life-threatening stroke can happen at any time. The likelihood of a full recovery is greatly improved if treatment begins during the first hours after the onset of symptoms. At the Neuroscience Center at St. Mary's Medical Center, we partner with local EMS teams to ensure that care begins as quickly as possible. St. Mary's brings together some of the region's most renowned specialists, innovative procedures, and advanced technology for treating stroke and other neurological and vascular conditions.
Anyone can have a stroke. A child can have a stroke. An elderly person can have a stroke. The 42-year-old marathon runner can have a stroke. Our goal is to minimize the amount of damage somebody sustains when they're having a stroke and to have the best outcomes for them possible.
As a comprehensive stroke center, St. Mary's offers a higher level of care, available 24/7, ready to meet the needs of all stroke patients from diagnosis to treatment to rehabilitation.
What makes a comprehensive stroke center comprehensive is that there's pretty much nothing neurologically that can't be managed here. It's very important that if somebody needs the highest level of care, that be available within the community, and that's what's available here at St. Mary's. Our patients get the newest and the best care available. We have access to pretty much every technology that's available for treating almost any blood vessel abnormality within the brain. We have the newest equipment, both in terms of the GE Innova system that's behind me, which is a Innova biplane. We actually have 2 of these rooms, which give us 3D rotational angiography, so we can literally see all of the blood vessels in somebody's brain real time in 3 dimensions. As far as treating them, we have access to the newest devices, such as the Covidian Solitaire device or the Stryker/Boston Scientific Trevo device, which is the newest clot extraction device that was just released. Here at St. Mary's, we're the first in Florida to have access to both of those and the first to use them successfully. By developing newer technologies and having access to these, we now are able to do things that we weren't able to do even a year or 2 ago. Patients survive that would not have survived. Patients do better that would have not have done better. It's all about EMS and fire rescue. If it wasn't for their identification, their dedication, their speed at which they bring people here, the protocols they follow to get the people here, none of this would be possible. Very, very few of our patients actually walk into the emergency room. We are heavily dependent and very, very grateful for their true dedication to bring our patients here.
The key thing when responding to a stroke patient is assessment. It's key for us. Once we determine it's a stroke, every second counts. We determine to take a patient to St. Mary's, depending on our protocols, we would pick St. Mary's over other hospitals because it's a comprehensive stroke center. They have the best care. They have the best doctors to take care of that patient. The partnership with St. Mary's is incredible. I am thankful to have it, and this community should be happy that they reach out with different agencies and do the best as far as patient care goes.
Stroke is an emergency. Seconds count. Learn the signs of a stroke and act fast. Face, arms, speech, time. If you observe any of these signs, call 911 immediately. When strokes occur, there's a place to turn to: the Comprehensive Stroke Center at St. Mary's Medical Center. St. Mary's Medical Center. Faith, community, and healthcare for more than 75 years.